So I made it to Syracuse. I'm here in my hotel. I decided to stay at the Embassy Suites Destiny. It's so nice, you guys. Let me take you from the beginning. So you walk in and it's like a suite. So it has like 2 separate areas. It has this like living room area, which is really nice. And then you walk into the bathroom here to the left. And I'm sorry I had to take all my stuff out of my toiletry bag because something spilled. So I am rinse that out and let it dry. Hold on, it's really bright, sorry. Okay, so this is the bathroom. I'll organize my stuff once that's dry, but this is the bathroom. So I hung up my robe, and then there's a toilet here. And then you can walk through the bedroom 2 ways. So here you can walk like through the bathroom. So this is a sliding door here, which is nice. And I have 2 queen beds. I thought I asked for a king, but whatever. And there's a little vanity here, which is nice. So I have my medicines there. So I'll have everything ready to go when it's time to do my shots tonight. And then yeah, here's the bedroom. There's a TV. And then this is the closet. It's just a pretty standard closet. I'm one of those people where I hang up my stuff in the closet. It's kind of dark. So I like to unpack things so I can know where everything is. But look at this view. Let me adjust this. Okay, so this is so nice if you're coming here, you guys, because they have a shuttle here and there's a mall right across the street. So there's restaurants. I mean, they're chain restaurants, but I love a good Cheesecake Factory. So I'm gonna have dinner there tonight. And I'm gonna go catch a movie because there's also a movie theater. I'm a big Harry Potter fan, so I'm going to see The Secrets of Dumbledore tonight. So I'm going to go to the movies, and then I'm going to grab some dinner, and then I'm just going to come back and chill and do some work here in the room. And yeah. So yeah, I'm going to head over to the movies tonight and see the Harry Potter movie, well, not Harry Potter, The Secrets of Dumbledore. And then I'm gonna grab some dinner at Cheesecake Factory, and then I should be back here by like 8, I would say at the latest. Then I have a little bit of work to do to get ready for work tomorrow, and then I have an appointment at CNY at 10:30 for all of my add-on appointments tomorrow morning, so just gonna make sure I'm ready for that. But yeah, I thought I would do a little room tour so that if you are coming here for treatment, you could consider this maybe as an option. We stayed at the Craftsman Inn last time. It's nice. It was just really small and it didn't have hot breakfast. So this is a little bit more expensive. And they don't have a CNY rate, but if you're a Hilton's Honor member, you can get a little bit of a discount per night. They do have hot breakfast. They have a full restaurant here. They have a bar. They have happy hour. They have snacks. So I think it balances out sometimes when you consider those things. So yeah, Embassy Suites Destiny USA is where I'm at, but I will check in later. I have to give myself the progesterone and oil shot by myself tonight because Tawashi couldn't make it. So that's gonna be interesting, but I'll record it so that if you have to do that, maybe some of the tips or tricks that I use might help you. All right, I'll see you guys in a bit. Okay, I just got back from dinner. I went to the Cheesecake Factory. Well, first I went to the movies. I saw The Secrets of Dumbledore. That was really good way to kill time. The movie theater and the restaurants were right across the street from the hotel. So, and they even have like a private like skywalk for the Embassy Suite patients. Embassy Suite guests. So I would highly recommend this hotel so far. It's been great. It's nice and clean. It seems like it's fairly on the newer side. So yeah, I'm gonna get ready now. It's almost time for me to do my evening shots. So I have to do the progesterone and oil by myself. I am not looking forward to that. along with the Lobinox and the Neupogen. So I'm gonna get all that stuff ready. I'm probably gonna go ahead and try to use the numbing cream again. Last night I just didn't leave it on long enough. So it's almost 8 now. I have to take the shot at 9. So I'm gonna give it like a good 30, 40 minutes to get nice and numb. Well, maybe 30, and if that doesn't work, then I'm just gonna use ice. So yeah, I'm gonna do that now. But yeah, I had a great time by myself. Just kind of reflecting on everything that's to come this week. I'm so grateful to be here and thankful that I'm able to be here. I do miss and wish Talashi was here too. But you know, sometimes you just gotta do what you gotta do. It's just really hard for us both to fly here last minute. We just got our notice to fly on Friday and it's Sunday. So, you know, imagine booking a flight 2 days in advance. So it's, you know, pretty expensive. My ticket was almost $600. So yeah, you know, you could do what you gotta do. But that's why I say for working with CNY, you will usually get about 2 days notice. So you have to budget and have money set aside. We had money saved for this, so it wasn't like a big hassle for us, but you know, you gotta prepare and plan for this. So yeah, so I'm just going to unwind and relax and get ready for this shot. And then I'll probably just, I might do a little bit of work, but also want to catch up on some shows and YouTube. I like watching vlogs too. All right, I will check in when it's time for the shot. Okay, you guys, I have to do this at 9, so it is, oh, I have my reminders. If you can see that, it is 8:58, so we'll go ahead and wipe off this, this numbing cream. So I have this, Tegaderm here. And this is just like a bandage that holds the numbing cream in place. So I'm just gonna take that off. I'll wipe that off. I think it's kind of numb. Let's see. I mean, yeah, it's kind of numb. But I also iced it. I'm gonna use ice for another few minutes, and then I'm gonna put the alcohol wipe on it because I just want it to be nice and ready. Okay. So my oil is warm, nice and like liquidy. So I'm gonna put this on. Let's check our time. 8:59. Don't leave your ice on too long. I did that once and I got like a frostbite mark on me, so don't do what I did. So I would say like no more than like a minute, you know, just keep checking. Just ice until you can't feel anything to the touch. So I look like I'm like 2 months pregnant, but this is like a hormone belly, you guys. When you're doing IVF and stuff, all the shots, sometimes they add weight on you. So, okay, I think this is ready. It's 9 o'clock. My alarm's gonna go off at 9. So let me tie up my shirt. Yep. There's my alarm. Okay, so it's time. So we're gonna go ahead and do the alcohol. Yep, I can feel it's nice and numb right there. All right. So, okay, you guys, I'm really scared. Okay. Gotta do like a dagger. 1, 2, 3. Okay, it's in there. Not bad, not bad. It's in there, I did it. Okay, just gonna pull back. Make sure there's no blood, no blood. So now we're gonna inject. Oh. It's really hard to push it in there. You can push it. Come on. Yep. It's really hard to get in there, but wasn't that bad. Oh. Okay, I'm just gonna count for like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you can see like where I injected it. So it doesn't need to be like anywhere near your butt crack. It needs to be more towards like the outer part of the top of your butt muscles, where you have the muscle, not into the fat. So I'm gonna just take this out. Oh, we did it, you guys. Recap it. I'm just gonna put the, well, the needle won't, the syringe won't fit in there, but the needle will. So, oh, we did it. Do have a little bit of blood. So now they recommend that you just massage it in for a couple of minutes. So I'm gonna massage it in, and then I'm gonna lay on my heating pad because you don't want to get any knots back there. So I hope you could understand everything that I did. But I don't know, I think the numbing cream worked. I left it on for like at least 20-25 minutes. I'll link below where I got my numbing cream from. I just got it off of Amazon. It's like 5% lidocaine if you want to try that. But I think ice probably works the best. But some people say to not put, you know, like oil into like a cold muscle. But if you just don't want to feel it, I say do the ice. Ooh, I got blood. Yeah. Okay, so I'm gonna get cleaned up and put pressure on this until it stops bleeding, and then I'm going to lay on my heating pad, and then tomorrow I'll be going into the office, so I'll check in the morning while I'm getting ready and then try to get some footage while I'm there. So I have to do my add-on appointment. My add-on service is tomorrow, so that is an HCG wash, which helps your uterine lining to be more sticky for the embryo to get like to attach to. And then I also mentioned I'm doing a PRP. So that's where they take my blood, separate the plasma, and somehow infuse it into my uterus to help, same thing, help the embryo implant, make it more sticky. So, I'm also doing intralipids. It's like a fat emulsion that they give you through IV. It all is supposed to help with the embryo implanting and to help the body to not reject the embryo. So, yeah, I will check in tomorrow and let you guys know how that goes. Good morning, you guys. So today is Monday, April 25th, and I'm all ready to go. I'm heading over to CNY today for some add-on services. So CNY has a lot of different add-on services you can do that will kind of help the embryo to implant. I mean, any little thing helps, right? So I'm having an HCG wash today, and that helps to make my uterine lining sticky for the embryo to implant, the embryos to implant tomorrow. And then I'm having a PRP uterine infusion. So they're gonna take some blood from me, separate it out from the plasma, and then they'll put the plasma into my uterus. Some kind of way to kind of help with like recovery and implantation and all that. And then, they will also, we're doing intralipids today. So let me show you that. We're also doing intralipids. So this is what it looks like, and they'll give it to me through an IV. So I had to bring this from home. I had ordered it with my medications, and that helps with implantation, and it's just like fat emulsion in there. And so it'll just go in my arm, and it'll just help with embryo implantation. So I'm excited to go back to CNY. I will, I gotta go catch my lift now, but I'll try to get some footage on my phone there so you guys can maybe see a little bit more of the office. I'm in the Syracuse location, by the way. Okay, bye. Okay guys, so I'm back from my first preparation appointment today at CNY. So I went in and had the HCG wash, the PRP done, and the intralipids. So that was good. I was able to get a little bit of footage of the facility. So if anyone's curious, like what does it look like? You know, sometimes people think because things are affordable that it's gonna look like a dump. But this is like the most beautiful doctor's office period that I've ever seen. It's literally like a spa. So I'll insert some clips there. So yeah, I just come in. The waiting room is really nice. Sorry, I don't want this to distract you, this reflection of the window. Let me put my head here. Okay. Yeah, so I come in and just check in and sit in the waiting room, and it's literally like spa music playing. So nice. And then, you know, they take me back, and I had my blood work done so that they could check it, you know, get it ready for the PRP. So they separate the plasma from the rest of the red blood cells, and they infuse that into your uterus. So I did that, took my blood work, then they took me upstairs to where I had the intralipids done, and that location was like even more beautiful. It was like, you know, lounge chairs all over, you know, recliners. So you can just sit down and relax while you're getting the intralipids for like, I think it was maybe like 20 minutes, 15, 20 minutes. And so what the intralipids does, I got more details. I had looked it up, but I forgot, but I just asked today again. So the intralipids help to suppress the natural killer cells in the body. And what it is it's literally like fats. So you get like an IV bag, they send it to you from the pharmacy, and it has like a milky white substance in it. You're not supposed to refrigerate it, but it's got like healthy fats like soy. I think it has like nut oil products in it, so and eggs. So if you're allergic to any of those things, you can't have intralipids because you will have a bad reaction. But I'm not, so it was fine for me. And yeah, it helps so that the body doesn't attack the embryo or embryos when they implant them. So I did that today. The nurse said that I could also get that like, you know, like through 8 or 9 weeks of pregnancy, I think. So I have another bag left, so I might do that like somewhere in Orlando when I get back. Yeah, so I did that, intralipids, and I come back down. And then I just got ready for my PRP and HCG wash procedure. So it's basically like a pap smear. They put the speculum in and they just put a catheter, through your cervix. So you might get a little cramping, and they were bearable. They were like, maybe like very light period cramps. And then they insert the HCG in there and the plasma for the PRP into the catheter, and then it just like washes, like, they kind of like give your uterus like a wash of it. So it's supposed to help to make your lining like really receptive and sticky, is what they say. Like people say sticky. I think the medical term is receptive, to be able to receive the embryos when they implant them tomorrow. So, I'm just gonna do anything and everything we can to make this process as successful as possible. It can't hurt to do that, so that's what we're gonna do. And so they changed my appointment for transfer tomorrow. I'm gonna be there now. My transfer is now at 8:30, so I have to get there about 8 so that I can do acupuncture before, and then we'll do the transfer. Hopefully with Dr. Kiltz. I got to meet him today. That was so awesome. He's so nice. He's just so sweet, so like good energy, good vibes, just very like positive, and so glad to meet you. He asked me to lower my mask so he could see my face, just very personable, which is what I love. And he's got 1 million and quadrillion patients, you guys. I mean, he might not have remembered my name per se, but we did talk about tomorrow, and he was like, I have surgery tomorrow in the morning, but I'll be done by like 8:30 or 8:45, so I'll do your transfer right after that. So that was awesome. That makes me feel so good. I'll get to have him for transfer, and then after that, I'll do my massage for an hour. And then I'll come back to the hotel, grab my bags, check out, because my flight doesn't leave till like about 6. So I'm just gonna probably just hang out, work in the lobby, and then I'm gonna head to the airport around 4:30. And then I'll be back home, and it's time for that 2-week wait. So I'm gonna find some things to do during that time to just keep my mind occupied. There is some other content that I want to make, so I'll probably go ahead and shoot that. It won't be IVF related, but I think you guys will still find it pretty interesting. It's about wedding planning. So I'm gonna do that. But this has been a great process. I love the accommodations of where I'm staying. It's so convenient to CNY. It took me like maybe 10-15 minutes to get there. It's like maybe a 15 to, depending on what time of day it is, like a 12 to $15 or $18 Uber ride each way. But the hotel where I'm staying, the Embassy Suites, Destiny USA, they are gonna give me a ride in the morning, as long as they don't have any airport runs. So I'm gonna have to leave here about 7. I'm gonna leave here like 7:15, maybe 7:30. Get there kind of early, check in, so that I'm all ready to go right at 8 for acupuncture. So yeah, that's the plan. So I'm gonna do some work now, and then I'm gonna go to dinner later. I'm gonna probably go back to Cheesecake Factory, because I love it so much. I know I'm basic. But no, I'm just kidding. Cheesecake Factory is great. But that's the plan for today, and I'm just gonna relax. I have my heating pad, so I still am feeling a little crampy after the catheter, went in there. So I'm just gonna use my heating pad. They told me not to take any like acetaminophen or no alcohol for 3 days. So that's fine. I'm not drinking or doing anything like that anyway, because we're gonna just pray that I'm pregnant. And that's it. So I'll check in maybe later or tomorrow. Oh, I will show you later on. The nurses marked my back where the progesterone and oil has to go. So I will show you that later. And I'm gonna try to maybe make another better video of showing you that. So other than that, I'll show you that later, and then we'll check back in tonight. All right. Good morning. It is 6 o'clock, and it's transfer day. I am so excited. My body and the Lord, I think, woke me up this morning at like 4:30. And I've just been kind of like in and out of sleep since then. Said a nice long prayer, because I think sometimes when you wake up like that, I think God wakes you up to have a talk with you and conversations. And I just really prayed for just being so thankful for God bringing us this far, and just telling God that everything was going to be put into God's hands. And that's really how I feel strongly. At this point, I've done everything that I can do with my body. The doctors have done everything they could with medication. So now it's time to turn the science over to God and just let him work it out. So I'm feeling really hopeful this morning. Talashi sent me the sweetest note late last night because he knew I went to sleep. So I'm gonna call him before, I get in my shuttle, and we're gonna say a prayer together. But just very excited about what's to come. If you're new here and just tuning in, today is embryo transfer day. We're transferring 2 of our highest graded embryos, and I'm really excited about that. Excited and still remaining just a little cautious because it's such a journey. So I'm gonna go ahead and get dressed, go down and grab some breakfast, and we're gonna be on our way. All right, you guys, I'm here at CNY. I'm at the Healing Arts Center. So you can see there's two buildings they have here. This is where like the main office and all the IVF stuff happens. And this is their Healing Arts Center where all the acupuncture and massage happens. So I'm about to go do my my acupuncture before transfer. Okay, so now we're going to where I'm gonna have acupuncture. Transfer will be in this building too. I was definitely in the wrong place. But you guys, look how like peaceful and serene this is. This is like a resort. This is not like any other fertility clinic you'll ever find. Like I'm all about aesthetics and just like the experience. And this right here, like, can I come here all the time? Just kidding. Okay, I think we're here. This is where it's all going down. Okay, I am in my acupuncture room now, but I just want to show you guys like how this looks. So like zen in here, comfortable. And I'm laying here on the bed, just waiting for my acupuncturist to come in. I'm super early. Yeah. So I am here with Dr. Kiltz. This amazing man has done so many wonderful things for the fertility space. His place here is gorgeous. And I just want you to say hi to everyone.
Hello to everyone. And this is a very, very challenging journey.
Yeah.
Do not give up.
Yes.
Hope is critical for everyone, and faith first, right?
Yes.
And we're lionesses and lions.
Yes, we are.
That's the most amazing thing I've learned. And keto and carnivore is kick-ass.
Yeah. Any advice for people starting this journey and losing hope?
Well, your shirt does say
It says
hope, right? Have only positive energy.
Yes.
And that's why I'm always reading something spiritual. I practice Christianity, but whether you're Muslim or Jewish or whatever your religious belief system is faith is critical in hope. And so you need to connect in ways with others in this tribe that are on the fertility journey.
Yeah.
Which is very, very, very difficult to stay on.
It is.
And so, but when we're communicating in this village that we're finding on so many platforms, it is so, so, so important. We can't promise the outcomes, but we can promise that we're going to do everything we can to work our best. But you've got to be doing the same thing as work and do your best, and we're learning, because medicine doesn't require a doctor anymore.
Yeah.
It really, it's the open access to information, so that's really critical. But most of all, faith every day, and have only positive energy is the acronym I use for hope.
Yeah. Thank you, Dr. Kiltz.
Oh, it's my pleasure.
I appreciate it.
God bless.
Oops. Gotta look cute. Can't be cute with one earring missing. Okay, let me try this again. Okay, what's up, you guys? Welcome back to another day. It's been a while since I've checked in, since the last time I recorded a video even. I think the last time I recorded a video, I was actually in Syracuse about 2 weeks ago. So I just wanted to check in and let you know what symptoms I'm experiencing in my 2-week wait. I don't have my pregnancy results yet. I won't be taking a blood test until Monday, which is the 9th of May. So that's actually it's more than 11 days past 3-day transfer. They say that you can't really detect the HCG in your body until at least like 11 days past transfer, at least 10 days, but they like to do it between 12 to 14 days. So I think Monday would be day 13 for me, 13 days past transfer. So 11 days falls on a Saturday, so they just kind of moved it to Monday, but just to make sure. So I just want to talk about some of the symptoms I've been experiencing. I don't know if I'm pregnant yet, so I don't know if I'll even post this video. If I'm pregnant, I will. If not, then I won't. But I just want to give anybody going through, a 3-day frozen embryo transfer some ideas of what I'm experiencing. So if it helps you, you can feel like, maybe you're experiencing some of these things, or maybe you're not. Some people have no symptoms at all because it's still just so early. So I've been taking notes of the things that I've experienced. I would say the first few days, I didn't really experience anything. I had really no symptoms at all, like the first couple of days. So I wrote down during the 2-week wait, 426, 427, no symptoms at all. And then, am I in focus? Okay, yeah, I'm in focus. Okay, and then the night of 428, I had like some slight cramps at night and I was tired, I noticed. On the 29th, I didn't have many symptoms at all. On the 30th, I had mild cramping in the morning, and then the cramps are like this is my uterus in like a V. They're like on the sides here. Just very dull cramps, not like period cramps, just kind of achy and just kind of weird. And then starting on May 1st, I started to get sore boobs. I noticed that in the morning when I was in the shower, and then some mild cramps still here and there. And then I had a lot of hot flashes. Like I had to change clothes that day, I remember. I just was burning hot, and I'm always cold. You can ask my husband. I'm always cold, so me being hot is weird. So hot flashes, sore boobs, mild cramps. And then on the 2nd, I had cramping in the morning. My cramps are usually in the morning. I don't really know. I did start to feel like some sharper pains on the sides. Dull, achy, sore boobs, really hungry. But I think the prednisone that I'm taking can cause your appetite to be kind of ravenous as well. Hot flashes still, and then just kind of like a heavy feeling when I woke up in the morning. I did have some frequent urination. I've heard that like HCG can cause that, or the hormones, who knows. So today is the 6th, and I'm still having cramps. Like they're pretty constant now. They're not like period cramps, but they're definitely noticeable. I would say last night I had like some pain on the right side, and I wasn't really sure what that was, but it was kind of like more of like a sharp pain that kind of wasn't going away for a while, but it's much better now. So I don't know. They could be related to the medications I'm on. Like I know progesterone causes a lot of like pregnancy and period symptoms, like sore boobs and stuff. So I'm still taking all my same meds. I'm taking estrogen 3 times a day, which reminds me I gotta go take mine, and progesterone at night, and then I'm taking like blood thinners, Lovenox at night, and then Neupogen which is actually I think a cancer medication, but it helps the body to not like attack the embryo. So I'm still on a lot of medication, so it's really hard to say what's causing it. But I just wanted to check in and give you guys just an update on what's going on. I go for my beta on Monday, so I'll definitely record that. And I wanted to do a home pregnancy test, and I don't know, I'm gonna see how I feel, because my beta results, I won't get them till late in the day on Monday, and that's gonna like drive me crazy all day. So Monday morning I go for blood work, and then I'll find out that evening. But other than that, that's all I'm feeling. I'm feeling good overall. Had a little moodiness here and there, but I don't know, my period is also due on Sunday. So I'm either getting a period or I'm getting a happy Mother's Day present. So with a positive pregnancy test. So we are gonna speak that positive pregnancy test into existence. So yeah, that's it for now. Like I said, I'll update you and let you know. If you're also going through a 2-week wait and you've done a 3-day embryo transfer, even a 5-day, did you take a pregnancy test before your beta? And if you did, how soon did you get a positive? And what symptoms are you feeling? I really like to know what everybody else is going through. So comment below and let me know if you're going through this, or if you have any questions. I'm a little out of breath and I don't know why. But hopefully that's a good sign. Hopefully it's some pregnancy signs going on, but we'll see. All right, so I'll check in once I have my beta results. You guys, our results are in. Just got the notification from LabCorp. I'm so nervous. We're gonna look at it together. That's old. Wait.
5-9.
That's today, right?
Yeah.
It's negative.
Wait, where you see that at?
It's less than 2. It has to be over 5. Sorry, babe.